Okay, so going live. This time I think I'm about 1 minute late instead of the 3 minutes late that I was last time. I still obviously haven't totally gotten the hang of this Facebook Live thing, and I think because of that, I haven't had anybody join me just yet. One of these days I will get that figured out, but as some of you might be aware, I've been a little bit busier than I expected to this week, both with actually my busiest patient care week ever here at Patient PT, but also with an article that just came out in the newspaper this morning about a side project that's been keeping me really busy ever since COVID-19 hit the United States, which is Bloomington Mask Drive. And so I've had some extra meetings and phone calls this morning that I wasn't really expecting to have, and did not have time to sit here in the peaceful quiet of my office figuring out exactly how live is supposed to work all the time. So without further ado, I think I'm just going to go ahead and launch into my Wellness Wednesday spiel. So last week, I answered a couple of questions about low back pain and some of the factors that can contribute to that. And past topics at Wellness Wednesday have focused on things like water and exercise and mental awareness of the way that your body is moving and things like that. Just sort of with the idea of giving folks more of a holistic picture of how health and wellness really work, which I think is something that the medical system kind of in general has gotten further and further away from as folks have become more and more reliant on health insurance companies. So today we are here to talk about a couple of different things. I got a couple of questions last week that I wasn't able to answer, and I suspect that a similar thing is going to happen this week because of the way that this live started off, but hopefully a few folks will join, and either way we will still have this video for posterity that you guys can watch at your convenience. So one of the questions that came in since last week was, are there any exercises besides Kegels that can help with uterine prolapse? So I wanted to talk a little bit about the fact that there are probably a lot of people who are surprised to hear a physical therapist talking about something like uterine prolapse, okay? One thing that a lot of folks are not aware of is that physical therapists receive some training during their regular Doctor of Physical Therapy program on the mechanics and workings of what's called pelvic floor therapy. Now, for a long time, pelvic floor therapy was called women's health therapy, but the reason that we don't call it that anymore is because both males and females have problems that can be addressed by pelvic floor therapy, and everyone has a pelvic floor regardless of what's on the outside of that pelvic floor. So just to give you all a little bit of a primer on what that is, I'm going to get out my trusty friend Herman, whose leg is already off, and I'm just going to leave it off because we don't need his leg today. But basically, the pelvic floor is a sort of tightly woven network of muscles that lays in the bottom of a person's pelvis, okay? So right here on Herman. And both men and women have that pelvic floor, and it's made up of a series of muscles that work basically the same for both males and females. And the job of the pelvic floor is to basically form a meshwork of muscles like this that hold up all of your internal abdominal organs, okay? So if Herman wasn't just a skeleton, you'd be able to see, of course, all of his various internal organs here inside this rib cage. And the reason I bring up the rib cage, and I keep showing you Herman, even though we're talking about a muscular thing, is because I want to talk about something that's called canister theory, okay? So a lot of people have heard of Kegels for various pelvic floor problems, but they don't really know if there's anything else that they can do. And to take it kind of a step beyond that basic, like clench the muscles in that area and they'll get stronger and be more supportive, there's also something called canister theory within physical therapy. So the idea is that this entire portion of your body that surrounds that your rib cage and pelvis surround is kind of like a big open space inside your body, and it's surrounded by muscles and bones on all sides. Boy, my allergies have been awful this week, so please excuse me if I cough. I promise I don't have the COVID. Okay, so inside your rib cage and pelvis, there's basically this whole canister, okay? And I'm going to use my little fakey whiteboard here to draw you a picture of it, okay? So it's loosely shaped like this, all right? So imagine the rib cage being up here and the pelvis being down here. So this is all surrounded by muscles and bones, and your muscles provide a lot of support to all of the organs that are in there. And a lot of different things can cause weakness in the pelvic floor. One of the most common, of course, is childbirth, and just all sorts of other things. We don't really need to get into that. But the idea behind Kegels, of course, is that you directly strengthen these muscles that are right here at the bottom of this canister, and that gives it more support, okay? But something else that isn't necessarily talked about as much, and what canister theory is really all about, is the fact that there is a big muscular wall right here, your diaphragm, okay, that a lot of folks have heard of. And then there's also another muscle that sort of wraps all the way around your torso that I end up talking about quite a bit in physical therapy, called the transverse abdominis, okay? So if your spine is back here at the back of the canister, the transverse abdominis actually wraps from this midline here where your belly button is all the way around and back to the same connective tissue that connects to your spine, okay? And it actually also wraps all the way down here to the pelvis and connects to all of the connective tissue down here and is thereby connected to this pelvic floor, okay? And so one of the things that you can do in order to strengthen the pelvic floor even further and start to take advantage of canister theory is strengthen these other muscles, okay? So you can practice techniques like diaphragmatic breathing in conjunction with transverse abdominis training, okay? So this big muscle that wraps all the way around your torso is a lot like a girdle, all right? And so what you end up doing in physical therapy a lot of times in order to support all kinds of things, okay? It's not just your pelvic floor, it's also a lot of times your spine or your hips. Folks who have chronic pelvic malalignments a lot of times end up doing transverse abdominis training. But basically, you learn how to train this really deep muscle that gets stretched out with all sorts of day-to-day activities or things that you just do as part of your daily life. And if you can get that muscle kind of turned back on and synced up with your breathing, it helps to create a more supportive sort of canister for all of your muscles, okay? So the idea is, if you think about a cylinder, known to be like one of the strongest structures, okay? If you press down on the top and bottom of a canister, it's really unlikely to collapse, all right? So a lot of folks know that down here at the bottom of the canister, they've got to strengthen up those Kegels. And there are some folks that know that coughing and breathing and sneezing and things like that can be a good indicator that your pelvic floor is not necessarily working all that well, because besides making problems like uterine prolapse a little bit more noticeable and prominent to the person who is dealing with those, they can also lead to things like urine leakage when you are trying to avoid peeing in your pants. And a lot of people become familiar with that as they get older. A lot of us don't want to jump on trampolines. And so that's where the rest of this canister comes into play, all right? So in an ideal world, this big muscle, the transverse abdominis, wrapping all the way around your body, is sort of synced up with your breathing. And so if you've got a firm canister surface down here on the pelvic floor with muscles, by strengthening muscles like the ones that are strengthened by doing Kegel exercises, and you've got your transverse abdominis synced up with your diaphragmatic breathing, then it sort of creates a vacuum that keeps everything right there in place. So that's something that someone like me who does not specialize in pelvic floor therapy could help you learn how to do as part of your PT. But really, if you want to get more hands-on treatment or you need more specific exercises key to your situation, you should go and visit a pelvic floor physical therapist who specializes in it, okay? There are all sorts of advanced training courses that I myself have not taken. I've just had the basic introductory training that comes as part of the Doctor of Physical Therapy program. But I've got a friend named Elizabeth up in Indianapolis that I would be happy to refer you to. And there are at least a couple of pelvic floor therapists here in Bloomington that are available as well. I just don't happen to know them personally. But physical therapy can be very helpful for prolapse of not just the uterus, but also the vagina and other pelvic floor organs that have a tendency to prolapse as one ages. It's a very common problem. And just for those of you who are not the person who asked this question or are maybe less familiar with all of it, prolapse is when an organ that is supposed to stay up above that network of pelvic floor muscles starts to dip below, okay? And sometimes that can actually be severe enough, like with uterine prolapse, for example, that the uterus actually comes out of the vaginal opening. And usually at that point, a surgical solution is going to be necessary. But going to visit a specialist pelvic floor therapist actually can help with it to at least prevent it from getting worse. All right, so that's kind of what I know about prolapse and pelvic floor therapy and how it all works. But there are a whole lot of much more specialized techniques that are available at a friendly pelvic floor therapist near you, and I definitely urge you to contact those folks. So the other question that I got in between this Wellness Wednesday and the last was, what can a physical therapist do about trigger finger? Okay, so trigger finger, as it's called, is a condition where one of your fingers kind of gets stuck, okay? And it's usually right there at that joint. Sometimes it's both joints end up being really curled. And you can, actually, it can affect multiple fingers at a time and like result in like a partially contracted fist like that. But usually it is just one finger at a time. A lot of times it is the index finger, and that's why they call it trigger finger, because that, of course, is your trigger finger. What it is actually a inflammation of the sheath that surrounds the tendons that connect the muscles up here in this part of your arm to your fingertips, okay? So the human hand is a pretty amazing thing, okay? We've got these amazing opposable thumbs that can touch like all of our fingertips and touch like the base of our metacarpals and everything. And when you have a job or, well, it's usually a job, but sometimes it's a hobby that involves gripping things constantly, those tendons can get really inflamed, okay? And eventually that can result in the sheath around the tendons that connect the muscles in your forearm to the ends of your fingers to get kind of a bubble in it, okay? And so what happens is there's a bubble in this sheath that is supposed to slide very smoothly over itself, okay? So essentially, it's like it's supposed to be a sort of slippery membrane where the surfaces slide smoothly over one another. But if you get a big knot in something that's supposed to pass through, it just gets stuck there, okay? So your finger gets stuck in place and you can't expand it out again. So when I was in physical therapy school, I took pretty careful notes and I kept track of all of the different PowerPoint slides and things that came up during what was called musculoskeletal, which is a class where we learned about how to deal with a lot of these different musculoskeletal problems. And really what was listed as the primary treatments for it under management were anti-inflammatories, okay, of course. Iontophoresis, which is basically a method of using like electrical stimulation to help drugs penetrate the surface of your skin. So again, that's kind of an anti-inflammatory pain relief kind of solution to it. And then ice and splinting are things that are used a lot of times with trigger finger and trigger thumb. Okay, it also happens quite a bit to the thumb because that's a really overused joint sometimes. And then of course there are injections that you can have and surgical release that can take place if it gets that far and becomes bothersome enough that you would like to have it surgically released. However, if you've ever been into patient PT, you know that I personally really strive to help folks avoid surgeries if possible. A lot of folks really don't want to jump to a pharmaceutical solution. Hi, Nola. Or to jump to a surgical solution, especially because, you know, once something has been cut inside the human body, even though we do have a pretty incredible capacity to heal, it's never really the same again, okay? So what I like to recommend for folks that are dealing with lots of different hand problems, including trigger finger, is something that's called Graston technique. So I actually meant to grab my Graston instruments so that I could show them to you. I'm going to go and grab them real quick. Abby, I just saw that you popped up, so I will answer your question after I finish talking about trigger finger. I'll be right back. Okay, so I popped into the other room real quick to grab my set of Graston instruments. Ooh, I'll actually point them at the camera there. So as you can see, they're very shiny. And essentially, I like to think of Graston instruments as being the solution to what a lot of people sort of wish massage therapy was able to do, okay? It's something that you can use to do a very deep kind of concentrated soft tissue work, similar to massage. So for TriggerFinger, most likely what I would end up doing is doing sort of a hand examination of your forearm to see if I could find any particular restrictions that seem to be contributing to the problem. It would probably be in flexor digitorum or a muscle group similar to that. And then you can use these Graston instruments. You put a little bit of, I use cocoa butter, but you can use almost any kind of hospital sort of lubricant, I guess. And then you basically run the instrument over the surface like this. And because it's made of die-cast stainless steel, I can feel vibrations through that almost as though I was actually palpating that muscle really deeply with my hand. So that is one of the things that I would do first after doing an examination of somebody who I suspected of having a trigger finger sort of issue. And basically what ends up happening when you do Graston technique is that the fibers in the muscles are sort of encouraged to go back into a healing process, okay? So you scrape, 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 and the cells in there sort of get the idea, they're on stretch while you're doing this. So the cells in there, the muscle cells, get the idea that they're supposed to kind of realign themselves and sort of reinitiate that healing process instead of just leaving it alone and prioritizing other things. So that's one of the primary things. And then another thing that you can do for trigger finger, if you can get it to release eventually, is start to institute a regular program of stretching those muscles out, but also some isometric strengthening. So sometimes trigger finger can be a pretty painful condition to have, and a lot of times it's very irritating. And so isometric strengthening of things is something that we also recommend a lot. So if your finger is like stuck like this, you would basically just be like holding it in place and pushing up against that to start to strengthen those muscles while you are continuing to do manual therapies, okay, like hand therapies or tool-based therapies on the muscle groups that are affecting it. Now, one of the things that you don't always hear is trigger finger is something that very rarely occurs in isolation. A lot of times when somebody's wrist gets all bound up, there's a lot of different muscles involved. And so sometimes it's not something that you can just sort of treat the affected area and have it go away. So I hope that that answers a question about trigger finger, but if the person who asked me that question is watching, feel free to sort of supplement it. So Abby, I see that you were saying that you had a question. Feel free to just leave that as a comment there for me. I'm trying to reply to it directly here. Here we go. All right. So, just to kind of wrap up the subject of trigger finger and pelvic floor, those questions that came in while I'm waiting for a couple more to come in. Essentially, the human body was made to move. It was made to do strengthening exercises, and sometimes you need a little bit of help from a physical therapist or even a massage therapist to work out some of those soft tissue restrictions and start strengthening up the muscles that are really supposed to be performing the motion or function in question. But I love to address issues like that. One of my specialties here at Patient PT is getting right to the root of the problem. And so, you know, if we start working on your trigger finger and you still want to talk to me about something that's going on with your foot or your hip or whatever, I will still absolutely work with you on those. So, all right. Well, once again, Abby, if you're trying to message me, I am not seeing that pop up with your question. So I'm going to go back at least briefly to talking about some of the things that physical therapists do, which was kind of the topic I originally had in mind for this week on Wellness Wednesday. Physical therapists really have seen their roles evolve quite a bit over the last, I'd say, decade or so. For a long time, as I alluded to last week, physical therapy was mostly based in rehab for various injuries or surgeries, and that's pretty much where most folks consider it to have stayed over the years. But physical therapy can help with all sorts of things, okay? So as part of my final year of training in physical therapy school, one of the things that a lot of folks are surprised to hear we do is we have a wound care class that we take, and we learn all sorts of things about how scarring works and different skin disorders and how to treat different kinds of wounds. Sometimes that involves specialized types of bandaging. Sometimes it involves knowing whether the condition that is underlying a chronic wound that are really common among diabetics and things like that, and addressing it with the right level of moisture or the right antibacterial agent. So wound care can be a pretty complex process, and a lot of folks who have diabetes or kidney failure or things like that, even sometimes folks who just have complex surgeries, end up having wounds that last a really long time. And physical therapists are trained to work in wound care clinics and address things like that with really pretty cool specialized solutions. Like a decubitus ulcer is something that is really unfortunately well known to folks who have diabetes. Okay, you can get a wound on your foot that just doesn't heal very easily, because a lot of times when folks have diabetes, they also have really kind of poor sensation in their foot. So they will not even know that they are walking around in an open wound until they actually like stop and look at the bottom of their foot, which I don't know if you've ever tried to do that or if you think much about what the bottom of your feet look like, but that can really become a pretty dangerous situation. And one of the things that physical therapists who specialize in wound care are able to do is called a total contact cast, where you basically build up a customized cast around the area of wound to take pressure off of it and leave it on there for quite a long time. And if you are able to do that, to take off one cast and put on another one, a lot of times you are able to give that wound the protection it needs for weeks on end. So that's one of the things that physical therapists are able to do and specialize in that you might not have been aware of. So I see now I've got Abby asking about her piriformis muscle. Oh gosh, I'm sorry, my nose is so itchy. I know that everybody's trying real hard to not touch their faces, but I promise I'm going to wash my hands before I see my next patient here today. Okay, so Abby says, my piriformis muscle was injured and it has been debilitating. I was wondering how I can strengthen that to avoid further injury. Okay, well, that is a great question, Abby, and one that is kind of hard for me to answer just sitting right here at my desk. So I'm going to unplug my laptop and monitor so that I can move over into the other room and show you from there. All right, so bear with me. All right, so here we are over in the treatment room at Patient PT. And the reason that I decided to move my live over into this room is because it's just kind of difficult to demonstrate certain exercises when I'm sitting at a desk and I'm just kind of a floating head. So, scoot this back just a bit more. So here's my treatment table. And I'm going to set this chair in front of it, actually just so I have a nice little platform in front of me so I can sit up here where you guys can see me. So when somebody has a piriformis injury, which is really common, and for those of you who don't know, I probably should tell you exactly what that is. So the piriformis is a muscle that's deep in the back of your hip, kind of in your butt, okay? It attaches to that big triangular bone that's at the base of your spine called the sacrum, and then it comes over and connects right to the top of your femur, okay, at a place that's called, I think it's at the greater trochanter that the piriformis connects. So if one needs to strengthen their piriformis, a lot of times it's kind of hard to tell the difference between needing to strengthen and needing to stretch. So this first thing that I'm going to show you is actually how to stretch your piriformis. And that is also not always super cut and dried. And I'm wearing a dress, but don't worry, I've got very sensible culotte type shorts on underneath it, so I'm not flashing anybody today. But anyway, so stretching piriformis is something that comes up actually a little bit more commonly, so I'm just going to start with that. But basically, what you do is cross your legs kind of old man style, okay? So you put your ankle up here on your knee, and you try to keep your leg relatively flat, okay? Some folks will have stuff that's really tight, so their knee will be way up here. And so if that's you, if that's your knee, the first thing that you want to do is try to get that knee down so that's kind of more level, all right? And you should feel some stretch kind of in the back of your hip when you do that. Next step, if you are like me and you've already kind of got a pretty good flat leg here, is to bend forward, and you should feel that stretch pretty deep in your hip back here. I've got fairly normal range of motion when it comes to piriformis, okay? So that is about the best result that you should expect. And when you're stretching, for the purpose of actually lengthening a muscle, most people will need to hold that for at least 30 seconds. And if you're kind of getting up in the years, sometimes you need to hold that for as long as a minute, okay? But I wouldn't hold it for longer than a minute. So then to strengthen piriformis, it's actually not piriformis that needs to be strengthened usually. Piriformis is what's called a stabilizing muscle, okay? Or at least it's supposed to be. It's one of the deep rotators of the hip, and its job is really to keep that round bone at the top of your femur kind of firmly seated in the cup of your hip socket while your leg is rotating around, okay? So really, its job is just to hold that in there firmly and help the rotation while your glutes do the major work of actually moving that limb around, okay? So the gluteus maximus, gluteus medius, gluteus minimus, they're the true movers of the leg and therefore the hip joint, all right? So in order to strengthen gluteus medius, one of the muscles or one of the exercises that I probably prescribe more commonly than anything else is called a clamshell, okay? So if you've ever had physical therapy, it's very likely that you have been given a clamshell at some point, because this is one that physical therapists love, mostly because that gluteus medius that it kind of focuses on strengthening is weak on almost everybody. It's just kind of a function of the fact that so many of us have jobs that involve sitting all day long. So anyway, to do a clamshell, what you want to do is lay on your side like I am now, and you want to have your knees bent, okay? And the thing to keep in mind here is that this is a muscle that is a little bit different for everyone. So if you are not really feeling this in your butt area at a minimum, you may need to change the position of your legs a little bit, okay? And that's one of the things that I end up working with people on here in my office when I can actually take a look and they can say, you know what, I know I'm supposed to be feeling it back here in my hiney, but I actually feel it like up here on the front of my thigh. A lot of folks have compensations that they've been living with for years. It's really hard for them to avoid that. So what I'm trying to say basically is your mileage may vary, and don't be afraid to adjust your legs forward, backward. Just keep that bend in your legs here and watch for feeling this kind of behind the crest of your hip, okay? You'll feel this big hip bone here. The gluteus medius and maximus are, the medius is right here kind of up close to that hip bone. It'll feel like it's coming kind of from that piriformis region and then reaching up here. And you'll also feel gluteus maximus, so that's kind of lower. You know where that is. That's kind of the meaty part of your butt. So basically, to do a clamshell, you are just opening your knees up like I am here and keeping your feet together. And the real secret to having a really good result with clamshell is keeping this motion very slow and very controlled, okay? So what I like to do when I'm doing a clamshell is actually put my hand here on my hip to make sure it doesn't rock forward and backward, because that's another thing that your body will kind of automatically do to try to compensate. So I put my hand here so that I can tell if I'm giving myself some attitude at this hip. Hold that nice and steady and then slowly lift just as far as you can and feel a good burn in your booty, and then slowly let it back down in a nice controlled manner. So I don't know if the video resolution is good enough that you can see there's the tiniest little quaver in my leg when I do it, but that is a muscle that is really weak on a whole lot of people who have had problems with their piriformis. All right, so I'm back up here close to see if I got any more comments in the meantime. I could show you a few other exercises to strengthen up your glutes. Basically, what it all comes down to is extending your leg backwards. Your glutes are there to sort of keep your hips lined up and supported while you are standing and walking around, and also to help you lift your leg out and to the side, kind of behind you, okay? So, getting good old Herman back in here. Put him on his stand so that I can focus on what he's doing with his leg. Okay, so glutes, okay, the piriformis is kind of here, and the glutes kind of fill up all the rest of this space on the outside. And what they try to do is lift your leg back like this, okay, and back at an angle like this. So when you have your leg bent like you are when you're doing a clamshell, that sort of eliminates the possibility that you are going to be using some other muscle like hip flexor, okay? A lot of people will use this muscle that's actually on the front of their hip to try to accomplish those motions. Or what's worse and what ends up causing a lot of back pain is they'll end up overcompensating with the actual erectors in their spine, okay? So, piriformis, that's a great question. That's one that comes up all the time. All right, so it is 12:32. I'm going to talk a little bit more about physical therapy and the different things that we specialize in, unless I have some more questions come in. And I'll probably wrap it up at about 10 till 1. Besides those wound care rotations that I was talking about that help physical therapists help folks who have things like diabetes and stage renal failure and other diseases that result in wounds that have a really hard time healing. I already alluded to pelvic floor being one of the specialties. And then one of my favorite specialties is actually inpatient rehab. One of my best friends from physical therapy school, hi Suzanne, is working at an inpatient rehab down in, I can never remember if it's South Carolina or North Carolina. Sorry, I'm not so great at geography, Suzanne. But she's down in the Carolinas doing inpatient rehab. Inpatient rehab is for people who have had usually a pretty serious injury and they need intense rehab before they can go back to their job, or a lot of times before they can even go back to their home. And a lot of times the goal of inpatient rehab is actually to help people get ready to go home. So at an inpatient rehab, there will usually be an occupational therapist and a speech therapist working together with a physical therapist to sort of give a full rehab solution to people who have really complex conditions like stroke, which of course we've been seeing quite a bit of because of complications of COVID. Sometimes when folks have had an organ replacement, like a lung transplant or a heart transplant. Thanks, Abby. Have a good day at work this afternoon, okay? Really almost any major surgery, but what we work with quite a bit are also spinal cord injuries in addition to those strokes, because anything that involves an injury of the central nervous system, which is the part of your nervous system that's in your brain and your spinal cord, those injuries can be very long lasting, very difficult and complex to heal. And so you need a really supportive environment that allows for multiple hours of rehab every day. And one of the things that I didn't really understand until I became a physical therapist that I would really like anyone out there who has a family member who is recovering from a serious illness, anything that ends up resulting in a need for more intensive rehab, is to remember that as a family member, you are really a key part of the rehab team, okay? When people are in need of intensive rehab, when they're trying to get back to walking after especially a stroke or a spinal cord injury or a major motor vehicle accident, they need all the support that they can get. Just healing is really kind of a full-time job, and it can get very frustrating during those times to have to rely on others to help you with all sorts of really basic needs. And one of the things that makes the biggest difference, especially when it comes to neurological injuries like stroke and spinal cord injury, is repetition and persistence, because the nervous system takes a very long time to heal, even under the best of circumstances. And because of a lot of complex interactions in the nervous system, when it involves the brain and spinal cord, injury is really pretty unlikely to heal much at all if you don't work toward adapting and recovering as much as you can pretty early in the process, and then having a persistent effort. Okay, so a lot of times when you're trying to do rehabilitation from one of those more serious injuries, people will sort of give up on continuing to recover, in my opinion, far too soon. If you have supportive family, especially, to keep you doing your exercises, to maybe help you to move through a full motion or get your hand open if you're in recovery from a stroke, one of the things that comes back very slowly a lot of times is full motion in your hand. Just keep in mind that persistence and letting your body know on a regular basis that you are still using it, you still need all of these parts that are maybe not working so well, that's really kind of the key to spurring healing in almost anything. I think that a big part of the reason that so many people end up having pretty significant surgeries or surgery after surgery is because a lot of times people don't really have a whole lot of hope of ongoing recovery after the initial medical intervention and stint in inpatient rehab. And that's just not true. Recovery can continue for years with persistence and adequate support. Okay, so that's just one of the many reasons that I sort of have this slightly different business model here at Patient PT, because I never have to worry about whether some cog in the system is going to stop me from being able to provide ongoing support to people who maybe just need a new set of exercises like every 6 months or something, because they are in one of these really long-term recovery processes. Okay, so another thing that a lot of folks are not aware that physical therapists do is work in inpatient environments like hospitals. There are a ton of different places that physical therapists appear in hospitals, okay? We work a lot of times in the ICU, intensive care unit, and a lot of what we've heard about COVID, you may have heard of proning and the importance of proning in COVID-19 treatment. All that proning really means is to put somebody face down, okay? So supine on your spine and prone is when you're face down. And the reason that things like proning really help with COVID-19 is because the shape of your lungs essentially allow for better drainage when you are in that prone position. And in physical therapy, another one of the things that we go through training for when we are in physical therapy school is how to do things like percussion, okay? And other treatments where basically you're kind of tapping on the person's back to try to encourage fluid movement and free up some of those spaces that are kind of stuck together with mucus or other secretions in the lungs. But more directly, physical therapists are involved in cardiovascular rehab. So if you've had a major heart incident, oh, here comes that allergy cough again, excuse me. Physical therapists are generally the people who help you actually get up for the first time when you've been in the hospital for really any kind of serious situation, okay? So if you've had a heart surgery, physical therapists are the people who have been trained in how to help you get up in a way that is both the easiest on you, the safest according to whatever injury you are dealing with, and the easiest on our bodies, because we're the ones who, when we are in a hospital or an inpatient rehab environment, we're really kind of helping lift people up, support them when they don't necessarily have full use of a limb. Excuse me. So whenever you're watching ER, Grey's Anatomy, a lot of these medical shows, keep in mind that when Dr. Gray is at bedside helping somebody get up for the very first time, Dr. Gray is never the person who's doing that. That's almost always a physical therapist. Sometimes it's an occupational therapist, because occupational therapists help people with what we call activities of daily living, or basic activities of daily living, such as eating, toileting, grooming, things like that. So if you have an issue that makes it so that it's hard for you to walk to the bathroom, it may very well be an occupational therapist who gets you up for the first time. A lot of times it'll be an occupational therapist and a physical therapist working together. So really, you can encounter a physical therapist in a hospital within the intensive care unit. You can see them in cardiovascular recovery. That's actually where I did a lot of one of my final clinical rotations was with a therapist who specialized in the cardiovascular recovery unit, and actually even in the emergency room. So a lot of times musculoskeletal conditions can cause like huge amounts of pain, and to somebody who doesn't specialize in the musculoskeletal system, it could very well seem like a pretty serious injury, muscular tear, a tendon tear, something like that, when we can do a couple of special tests just to put a little bit of pressure on that muscle and figure out that it's actually something that's very temporary. Oh, I am trying so hard not to cough again, but I get very dry when I talk for this long. So let's see, it looks like I've been talking for 40 minutes already, and I have talked about most of the things that I wanted to talk about, but I just glanced over at my wall and saw my poster of the lymphatic system, and that reminded me of one more specialty that I wanted to take a moment to talk about within physical therapy. So that is when it comes to lymphatic systems, okay? So a lot of times after somebody has had cancer, for example, breast cancer, you have to have what's called a lymph node removed. And sometimes just as part of diagnosing cancer, you have to have lymph nodes removed. And lymph nodes and the lymphatic system in general have been treated as sort of a not so important part of our bodies for kind of a long time in the medical world, mostly because lymphatic vessels, they're very similar actually to blood vessels, but they're very small. They're really difficult to see whenever you do a dissection of somebody. And they also are very important to the immune system. And the immune system, oddly enough, is something that's really kind of neglected in a lot of medical literature. But what it comes down to is after you've had a lymph node removed, there is fluid that is not necessarily going to move as smoothly as it is supposed to. So if you have a lymph node in your armpit removed during a mastectomy, or just for diagnostic purposes in breast cancer, you might end up starting to have a whole lot of swelling in your hand that is very difficult to manage at that point. And one of the things that physical therapists also get training to do and can specialize in is managing issues with lymphatic flow. It's a lot of times in conjunction with wound care physical therapy. A lot of times you'll see physical therapists who are employed by nursing homes, and at nursing homes and other sorts of skilled care facilities, physical therapists have all kinds of different roles. A lot of times it's very similar to in an intensive rehab, like I mentioned earlier, but it's just not for quite so many hours a day of therapy, so those therapists are able to see more people in a day. And then another environment that a lot of folks don't think of when they think of physical therapy is in the school systems. There are physical therapists who specialize in things called there's a program called First Steps, where children who have various, usually mobility related deficits, difficulty walking or difficulty like moving their hands in space, will benefit from daily therapies that are incorporated into their education programs, including things like aquatic therapy. Aquatic therapy, of course, isn't just for use in the school systems. Aquatic therapy is actually available at least one of the IU health facilities here in town, and it can be really helpful for folks who have fibromyalgia and other disorders that make it really difficult to move around with full body weight, or if you have issues with your vascular system. So oh, I'm sorry, the term is escaping me right now, but a lot of times when people have a lot of ongoing swelling in their feet because of vascular problems, aquatic therapy, which is therapy that takes place in a pool, can be really helpful and less painful, and it also takes stress off of the rest of the joints in your body because the water, of course, takes on some of that weight. So, oh, and then of course, one of the most exciting things that physical therapists do that some of you may be aware of is we actually work with professional sports teams and a lot of athletes. A lot of times sports teams and other athletics involve athletic trainers as well. Athletic trainers are kind of more, they're very similar to physical therapy in a lot of ways, but athletic trainers are sort of geared more towards helping people get back out on the field, and so they are trained in a lot more intricate kind of taping techniques, and there's kind of more emphasis on that in their training. And sort of their job is to help people know whether or not it's really safe for them to get back out on the field and how to best do that without injuring themselves further. Physical therapists have obviously a lot of overlap with that, and we will also help to make training programs for those athletes and help them through every stage of recovery if they have a major surgery due to injury. So, really, you can find physical therapists throughout almost every part of the healthcare system and within a lot of other places that you wouldn't necessarily expect, including corporate environments. There are more and more big companies that are actually hiring physical therapists to come in and help them with things like desktop ergonomic setups and posture related issues and just really all sorts of different problems that can stem from people working at desk jobs or industrial jobs that involve like lots of repetitive motions. If you're working at an assembly line or something like that, you will develop things like TriggerFinger, like we talked about a little bit earlier. So, really, I mean, physical therapists are kind of there for you at almost every step of the healthcare system and in many other places. And you'd probably be surprised at sort of the breadth of our knowledge and all the different things that we can sort of give you a hand with. So, if you are not so thrilled with the medical care that you've been getting at a physician's office, and especially if you are not seeking a pharmaceutical or surgical solution to your problems, you might want to try consulting a physical therapist like me instead, because there are probably treatment options that you had no idea even existed. Um, okay, so I think that that's all I wanted to talk about today. It looks like I have like a record number of like 4 people watching me right now, so I hope that you tuned in time to get some of the good stuff out of this. Herman and I will let you know when the next time we are going to go live is, and I don't know if it'll be an Ask Dr. Clark or if when I get started again, I'll be going back to more of a kind of lecture series where I'm covering kind of a large topic and a little piece at a time. So if you have feedback for me on what you'd like to see in the future on Wellness Wednesday or any other patient PT lives, just let me know and I will try to answer your questions and accommodate that as best I can. Otherwise, come and see me here at Patient PT. My website is patientphysicaltherapy.com. The phone number here is 812-558-0708. Well, thank you, Vanessa, for tuning in, one of my most loyal viewers. And I will talk to you again soon. Have a good one.